Hi, and welcome to And So Much More. I am your host, Cami Smith, and I am here with two wonderful ladies. We have Cara, who is a hospice nurse, and then we have Brittney, who is our Director of Student Affairs. And I'm going to have them explain and describe what it is they do at Centra and what brought them here in just a moment. But just to set the stage, we are going to be talking about something that we've been leaning into since the beginning of this year, and it is as we're looking at things like physician shortages, nursing shortages, and just like the healthcare industry needing to fill some of these roles to provide care, what is Centra doing to educate the next generation and to introduce like what a career in healthcare looks like? And that is, yes, because we need to educate the next generation, but also because like where better to start to kind of build a fire and an excitement about healthcare than in your own community, because then you have this homegrown care that is coming back, and it's a really beautiful thing. And so that's kind of what we're going to be talking about today. But first, we can start with you, Cara. Why don't you just tell us a little bit about what you do and what your role is?
So I am considered a case manager with Centra Hospice, and so not only am I taking care of the patients in the home, I'm also managing their medications, their supplies, and also working with all of the disciplines, which include social work, chaplain, and of course the providers and nurse practitioners. So I work Monday through Friday, and I see, I have a caseload of patients that I see every single day. And yeah, I love it. It's been great.
That is so much more than I think I was expecting you to describe. You do a lot.
Yeah, it's a lot, but I love it. I don't know, it's you make connections with patients that you normally wouldn't get when you work inpatient. It's like, hey, I'm going to be your nurse today, and you might be gone the next day. Yeah. But when you're working in the home, I'm the face you're going to see.
Wow. Every
single week that I'm there. So yeah, it's been great.
You kind of become their community.
Yeah.
That's so cool.
Yeah.
Okay. And Brittney, what about you?
Yes, so I'm Brittney Aagaard. I'm, as Cami said, the Director of Student Affairs, and I've been with Centra for 8 years now. And I love my role. I get to work with students and do anything related to education throughout Centra. So we have an amazing team that handles all kinds of students that come through Centra. We do scheduling, onboarding. We host internships throughout the year, and we do a lot of community work as well. So as you said, kind of getting connected with our local community. Yeah. My role is really to expose students to Centra and find opportunities to bring them in. So
I love that.
Do a lot of great work.
So some of you who've been listening, you may have heard the term OMESA. And when I started working here, first of all, there are so many acronyms in the healthcare industry,
yes.
And so it's a lot to learn. But OMESA is not one you hear super often. So Office of Medical Education Student Affairs. Is that correct?
That is right. You got it.
Yes. Okay.
Very good.
So what types of students do you interact with?
Yes, so we have really from the youngest generation that we can bring in to the oldest that are pursuing education. So we have, of course, our middle school, high school students that we're bringing in through camps. Mm-hmm. We do internships for a lot of our high schools. So we do a Central Virginia Governor's School, STEM Academy, and the Beacon of Hope that we partnered with. So we offer internships throughout the hospital for them. And then we're also working with allied health professional students. So we're bringing them in to do their clinicals, again, onboarding.
Okay.
And then we also have some partnerships, close partnerships with our University of Lynchburg PA program and Lucan Medical School. And so we are, again, handling most of their rotations, getting them scheduled with our physicians and APPs and bringing them in, to be a part of the healthcare team and do their clinicals. So
what's crazy is I don't think the average person would think Centra was like a teaching hospital. And I mean, I'm not going to go out there and declare us as, yes, this is what we are. But in my experience, there is so much. And I think so I've had 2 babies over at Virginia Baptist, and I had a student in the room for both, and they were wonderful. They were a part of the care team. It's not just this, person standing in the corner taking furious notes, scared to death. They are so good and so integrated. It was really cool to watch. And that was long before I worked here. And so now to hear kind of like the workings of how this is happening, I think that's really cool. I mean, you get to see a lot of excitement, I imagine.
Yes, it's been really great. We've created some amazing connections, and to be a part of their journey and then watch them come into the healthcare system and start working as providers, and then we ask them to teach students. So it's a really a full circle moment when that happens. They become the preceptors and they were students. So it's become a community for the ones that have matriculated through.
Very cool. And it's so funny. So we keep alluding to this and we're laughing about this inside joke. So Cara actually was one of the students who came to, and I don't want to tell your story, so I'll have you tell the details, but who came to a camp here at Centra. And then, I don't know how many years ago, but now here you are working at Centra. So tell me that story from beginning to end.
So I saw that Centra had, a healthcare camp, and my dad was like, I think this would be really good. It's during the summer, get you out of the house, and I was like, okay, cool. Didn't really know what I was getting into, obviously, because I was like,
but
I don't know.
You were getting out of the house. So
right, I was getting out of the house. So it was like a win-win. But it was great. When we got there, we even did like a little project with everybody. We got to round on the floors with the doctors and the nurses. It was just great experience. And you got to be with other students who were around my age. I think I was 16, maybe 16 or 17. You got to be around others who wanted to work in healthcare. So it was like, oh, so I'm not the only loser that wants to be in healthcare. Just kidding. But it was nice. It was like, oh, there's others who are interested in this. And I remember distinctly 2 memories. One, we got to suture a pig's foot, and then they took us to the morgue. And people freaked out, and I was like, I think this is cool. Like,
so maybe this is how they determine who really wants to do this, and he was like, nope, I'm good, I'm out.
So those were like the 2 things that stuck with me, and I was like, wow, I could do this. I liked seeing how the nurses and the doctors worked on the floor, because we went to the ICU floors, and you have to work together on any floor, but you really need to work together on an ICU floor. So that was really cool.
Wow.
Yeah.
That's incredible. And so now you are back. How many years later did you come back?
So I started nursing school right when I got out of high school, so I don't know, 8-ish years after. I worked as a tech. My background's behavioral health, so I was a tech on Monday 3 at Virginia Baptist, and then I transferred to being a nurse for almost about a year, and then I came to hospice, so yeah.
Okay, so was there a moment at that camp, if you didn't know before, but was there a moment at camp where you were like, this is what I want to do?
When we were on the ICU floor and I was with the nurse who was doing like 500 things, I was like, I want to be able to do that. Maybe not an ICU level, but I want to be able to feel like I'm competent enough to make decisions for patients when it comes to their medicine and how to take care of them. It was just like, I can do that and I want to do that.
Yeah. So. Do you feel like you were really prepared and you understood like, what steps do I take now? Like, I want to do this thing. I'm surrounded by this health system. Like, how do I get there?
Oh, yeah, I definitely did.
Yeah.
Because it wasn't just nursing based. It was people who wanted to, were interested in being doctors or PAs or nurse practitioners. And I felt like they gave us enough to be like, this is how you take those steps and get to where you want to be.
Yeah. That was actually going to be my next question is like, is this focused towards any type of like specialty or type of caregiver? And if so, it sounds like it's not, but what does the program look like?
Yes, so our goal for the health career camps is that we expose as many healthcare careers as we can, just to open up the eyes for students to say, hey, like this is something that I didn't know existed, and this could be something I really resonate with, just as Cara said. So we try to not only just focus on the physician and the nurse that you typically hear about, but we try to also focus on all the other careers, and we have so many wonderful people that participate to help us with that. But I think it's important that we do focus on some of the other careers out there, because I know when I first started in healthcare, I learned so much, and I had a little bit of a background in healthcare, and I had no idea what existed. So I think it's still important that we put focuses on nursing and physician, because there are shortages there too. And so we want to bring all of that to the camp. But bringing in pharmacy, bringing in our medical lab, techs, and see what they do every day.
Yes.
Our physical therapist, our occupational therapist, and really seeing, what does it take to, for a healthcare team to work together, and how can we, expose that to kids to get them excited about it.
I love that. And when I think about the only experience, well, I don't want to say the only, my first experience, because same, when I first came into healthcare, there's so much you don't know from the outside. Like behind the hospital doors, it's mind-blowing.
Yes.
They are some of the most hard-working people I have ever met. And it's a passion. It's like you guys are there. You are some of them. But there is a passion that is driving that I don't want to say I didn't expect, but it was just so encouraging to see that they're not just here for a paycheck. Like there is this caring, very talented, excelled individual who is spending their time in this way. And so that was my first takeaway from getting into healthcare. I was just kind of blown away by the caliber of people that I got to, work with.
Yes.
But then we had a Beacon of Hope luncheon, and there were some Beacon of Hope students, and so just like sitting, getting to know them, it was at the end of the program, and they were kind of like, sharing what they learned and what they wanted to do. And so I sat down with one girl, and she was telling me how she's like, I'm going to be a lab tech. She's like, I came into this totally thinking I was going to do something else. She's like, but I loved every minute I got to spend in the lab. And she said she was just so excited by the very detailed and how much knowledge really you had to have to do these very detailed things.
Yes.
And she just was like so lit up. Like she was so excited.
Awesome.
And that was my first experience with Beacon of Hope. And then we've had some Beacon of Hope students come in through here. We've had some Project Search students come in through here. Yes. We've had I even think we had some interaction at one of the OMESA camps. We got to go in and we were just there to take pictures, but it was very fun.
Yes.
And so, I mean, there's so much. And so people who are watching are probably wondering like how do we know, like how do we get involved in this? Where do I learn more? Where do I sign my child up for summer so I can get them out of the house? Because I'm thinking that too. Yeah. So how does someone learn more about camps or really any of these opportunities?
Yes, so we are currently in the process of kind of building our camps for 2025. Okay. So you can actually go to the centrahealth.com website and click on education. Mm-hmm. And we have our OMESA page as well as a section called K through 12 programs, and the camps will be highlighted there. So there'll be all the information you need to know about how to apply. We also, here locally, we reach out to all of the local schools. So public schools, private schools, we've even had homeschool children come and apply. So we reach out to the guidance counselors and pass all this information out. So sometimes it's even distributed through school. Yeah. So we try to get the message out as much as we can. And then the other thing to know too is that Bedford and Southside they're hosting camps as well. So which I think is amazing that we're able to offer this to people that maybe geographically are closer to those locations but can still have an opportunity for this. Cool. So they'll be advertising as well for their camps.
Yeah. Wow. So it's coming. So Cara, what advice would you have for either the student who's like, yes, I want to do that, or the parent who's maybe like, I don't know, I have a middle school student, are they ready? How would you advise them to take this opportunity?
I think no matter what age, it's good. Because I've known my whole life that I wanted to be a nurse, but sometimes kids don't know, and that's scary for them. And going into these camps with an open mind, like the lady you were talking about with that she didn't know that was something that she wanted to do, to be a lab tech. And she went to, had this experience and was like, this is awesome. And that's kind of what these camps are good for, because you're getting to see so many different avenues of healthcare. And so I'd really encourage parents who are like, I don't know, to definitely look into it. It's worth it. I felt like it was worth it when I was a teenager. And it's obviously supervised. They're going to be in a good place.
Yes, they're going to be safe.
Yes.
We've got them.
We got them. So I would definitely encourage them to.
I love that. So is there anything I haven't asked that you feel would be important for our listeners to know?
I would say, knowing what you're going to experience at the camp would be, because you may not exactly know what you're getting yourself.
What am I signing myself up for?
So, as I mentioned earlier, we are trying to get as many departments as we can involved. So one of the great things is that you're having the opportunity to work with real healthcare professionals that do this job day in and day out. Mm-hmm. So they're the ones doing the education. And I think that just enriches what they're learning so much more.
Yeah.
And the team that we have that comes in, we just have so many volunteers that come in to help with this. They come in on their days off. They're really passionate about the work they do.
Yeah.
Last year we had, I want to say, over 70 caregivers that came and dedicated their time. And that was just here in Lynchburg. So I know there was more at Southside and Bedford. So they're doing amazing work just to help put on these camps and teach the kids when they come in. But we're doing really cool, fun things, hands-on activities. So last year we brought the infection prevention team in, and we had a simulated outbreak. Where,
appropriate. The kids were like, I know exactly what this is.
Yes, they were very familiar. So how do we trace this? How do we make sure that, we stop the spread of germs? Who was the original carrier? We have had Dr. Laura McVeigh has been very gracious and helped us do some pig heart dissection. So she's not only helping them dissect, but teaching them heart anatomy as well as a cardiology PA. We had last year, you talked about suturing pig's feet. We actually did some suturing of bananas. A few of our APPs came in, and the students just thought that was the coolest thing in the world. Cool. We had, like I said, our pharmacy team has come in to help. I'm not even going to, say everyone. I'm just so grateful that they participate. But we also introduced Civil Manoa came in and did a section on nutrition. And as a middle schooler and a high schooler, what are some things I should be thinking about from a healthy lifestyle?
I love that.
So we're not only talking about careers, but we're talking about medical topics. That's just really engaging, and it's that chance for students to really kind of spark interest, because you just never know what you may come in knowing that you want to do something, but then you could be totally surprised and do something different.
That is very cool. Well, I hope that those who are listening can see the opportunity that is here, whether it's camps or some of the other things that you were listing off earlier. So check them out on our website, centrahealth.com, and then click on education. All types of information there, including actually not centralized what we're talking about, but Centra College is also there for you guys who are maybe a little bit further along. You know what you want to do maybe for nursing, and you want to take that next step. So go check that out. And thank you guys. Thank you for coming and sharing your experience and talking about what you're so passionate about. I really appreciate your time.
Yes.
And thank you guys. Yeah, thank you guys for joining us on And So Much More.